My name is Becky. I am 57 years old, and I have been battling depression the majority of those 57 years. When I was a child, I was born the eldest of three children and was raised by both my mother and my father. So had a very normal Midwestern upbringing. A few little bouts of problems in the family, but that's not unusual, nothing too severe from my perspective. However, one of the things that I noticed was that my mother would get very moody at times, and it would sometimes linger for a few days, or she would get a little bristly, lose some patience. But I just thought this was typical for mothers, so again, didn't think much of it. My personality was that of that resembled my nickname. My nickname was Pollyanna because I was always positive. My parents said I never met a person that I didn't like. I never had strangers. I just always had friends. I had a very positive outlook on life. If you will, I think I'm one of those people that primarily has a growth mindset. I believe that there are good things that are going to happen, and that if I work hard and try my best, that good things will happen, that I can be successful. So I was always happy. I like to smile. I like to sing. Never an inkling of anything other than that kind of a personality until the time I hit about high school. Developed some relatively high levels of stress. In fact, was hospitalized for what they thought was a brain tumor, and it ended up being a stress or tension headache. I had to be medicated for that. I also learned some biofeedback techniques, learned to control some of the muscles in my forehead area so that I could relax when one of those headaches was coming on, and that's helped me many years. I would also mention that while I was a teenager, my grandmother, my mother's mother, she lost her husband, my grandfather, to cancer, and I noticed for a period of a few years that Nanny, what I called her, seemed much moodier than usual. She was prone to fits of crying and some anger and some tension, things that didn't seem to be the Nanny that I once knew. And I attributed it to having lost my grandfather and nothing more. Well, I ended up, after grad school, getting married and moving to Thailand, of all places. My husband and I worked there. We were missionaries, and I was a teacher. And started off, I just absolutely loved the country. Well, I love the country to this day. Enjoyed life, and things were rosy. But there was a lot of adjustment to be made. So we had to learn a new language, lots of cultural differences that we had to adapt to. The living conditions were much different, even in our own home. And then just our general lifestyle. We had to adopt more of a Thai lifestyle, which was different from an American lifestyle that we were accustomed to. But although it was difficult, to me it was all an adventure, and again, I loved it. It was wonderful. There was stress, though. Then I had my first child, and Jennifer was born when I was about 30 years old, and things went well after the birth of my first child. There was nothing that was significant, as well as my health changes, other than what naturally occur with the pregnancy and labor and delivery. Beyond that, though, we moved to a little place or a big place called Chonburi outside of Bangkok, there in Thailand, and we became more isolated at that point. There weren't any other Americans that we knew of that lived there, very few Westerners at all, so we were having to relate to everyone and talk about everything in Thai, of course, except just within our own family. During that time, my husband began showing signs of, increasing signs of anger. He rather vicious in his talk. Um, Started really reacting to me by putting me down, by complaining, and I just took all of this in. That was something new to me, but took it all in and began to think a lot about it, and ended up very, very stressed. The relationship with my husband became very rocky. I realized my own self-esteem was fairly low, but I really had no one to talk to about it because it was very difficult to discuss those kinds of things in Thai. And there was no one around who could communicate in English to the degree that I needed to be able to talk to someone. So it was rough for a while. My husband was away a lot, and I was even more isolated, but when he was home, he was not a very pleasant person to be around. So it was very difficult. But then, after a while, we came back on what's called furlough to the United States for about 6 months. Brought our firstborn back, and we were with grandparents and aunts and uncles and cousins, and it was just wonderful. I noticed that I was feeling still a little more agitated than I was used to, and more tired than usual. But again, young mom, you attribute it to just that, being a young mother. While we were on furlough, I ended up getting pregnant again. And when we returned to Thailand, it was not, very many months afterwards that our second child was born. And it was, great labor and delivery as it had been with the first one, no problems at all. But about, 2 to 3 months after giving birth, things sort of came crashing in on me. My husband was still he would put me down a lot. He would be angry when I didn't respond the way that he wanted me to or he expected me to. We were very isolated. We had moved back to Chonburi. I had no one that I could really talk to, and I was expected to put on a happy face and go out. But I noticed that I kept feeling, I would think that with depression you would call it sad, but it wasn't sadness to me. It was almost a feeling of hopelessness. It was as though I really didn't have control over much of anything in my life. And on top of that, my husband would notice my mood, and instead of being encouraging or trying to lift me up or help me, he would make it clear that if I acted this way when I was around the other missionaries, that he would be less likely to get any position of authority in the mission. And he was out to be a leader in the mission. So he basically, well, not basically, literally, and in these words, told me to pull myself up, literally pull myself up by my own bootstraps. And I couldn't do it, but I had no idea what was going on. Didn't know what was going on with me. I felt hopeless. My self-esteem went to rock bottom. I had no confidence, even in things. I was an English teacher there, very confident English teacher when I left to go to Thailand. I had become totally lacking confidence in myself at that point too. It became difficult for me to make simple decisions. I remember many times getting up, and it was tough to get up out of bed, but I'd get up and go to pick out something to wear for the day. Not that there was that much to choose from, but I would be overwhelmed at the decision-making process I had to go through to decide on an outfit. And I remember that as it got worse, I would first start going back and just crawling back in bed and saying, I can't do this. And then it continued to progress, and I got to the point that instead of going back to bed, I would curl up on the floor in a fetal position, and I would just rock and rock and rock, trying to calm myself down and trying to get to the point where I could function. I remember one morning, my then, goodness, she was at least a year old daughter in bed. She was crying. And I went down the hall to her room, and I was so overwhelmed with her crying that it's horrible to say, but in my mind, I pictured myself holding her down in bed and smothering her, because I just didn't think I could take any more. I knew I had reached a brink, but I didn't. I thought I was losing my mind. I didn't know what was going on with me. No one had ever talked to me about depression, so I didn't know. Very fortunately, of course, I didn't do anything that morning. I went back to my room, curled up in a ball on the floor, and just rocked and rocked while I listened to the baby cry. I couldn't cope, couldn't deal with it. Quite fortunately, a few days later, we had some friends who lived in Bangkok who were American drop by out of the blue. No announcement. When I knew people were coming, I tried to figure out a way to either get my act together and act right, or Howard would tell them I was sick and couldn't come downstairs. But that day I was downstairs and they came. And the moment that the lady, it was a husband and wife, the moment the woman who knew me pretty well, known me for several years, looked at me, she knew something was wrong. And she said, "Becky, I need to go down to the market for something. Would you come with me?" And I did. And we got down to the market, and we did not get out of their car. She and I sat in the car and talked for over 2 hours. And I poured out my heart and told her what I was feeling, what was happening, even told her about the fact that I was afraid I was going to harm one of my kids. And I just cried and cried and cried and cried. And the woman, Glad was her name, very appropriate, had experienced depression before. And she started talking to me and started explaining that she wasn't a doctor, but that from everything that I was telling her, she thought that was what I was experiencing. And she took me back home, and she called her husband over to the side, told him a little bit about what was going on. And the two of them together confronted my husband. And they told my husband, "Either you pick up the phone and call the doctor right now, or we will. It is your choice. But your wife needs help, and you've got to get her the help she needs." Well, with Glad and her husband there, my husband picked up the phone and called the doctor, who was also in the mission and also a friend of ours, and made arrangements to get me right on over to him. And he gave me a definite diagnosis of depression, didn't know what else, but depression, and immediately put me on an antidepressant. But he was not a psychiatrist, and there wasn't an English language psychiatrist available, and they didn't believe that this was something I could probably deal with in Thai. So they started making arrangements very quickly to have me flown back to the States. They put me on Valium to help me. I was not sleeping. I couldn't seem to sleep, couldn't relax. They put me on Valium, and I do remember that by the time I got the flight home from Thailand, I was on 20 milligrams of Valium a day and was still not sleeping. So massive sleep deprivation. I felt a little bit better having a sort of diagnosis, but I just couldn't imagine. In my mind, being depressed meant being sad. And it wasn't sadness that I felt. It was a complete lack of ability to deal with life or anything in it. So we came back and went to stay with my parents just a few days, just long enough to make the arrangements to get me in a hospital. During the time at my parents', I really don't remember any of it. But my mother did, and she would tell me that she'd never been more scared in her life. because I would go and curl up in a ball on the floor in a fetal position and just rock and rock and rock. And I really couldn't talk much. I was just, I couldn't function. They put me in the psychiatric ward of the hospital and got me the immediate care of a psychiatric team. And I only had to stay in the hospital 1 week. The only thing that I remember about the entire week is the fact that that was the week of the last major San Francisco earthquake. And it was almost as if I just lived through the earthquake and don't even remember anything else that was going on around me. But what they did was transition me through several different medications until they found something that left me relatively stable. And I wish I knew exactly what they had left me on at that time. I don't. I've gone through a number of antidepressants, and I'll tell you about them in a minute. But for that point, I got to go back home at my parents', and then we ended up getting an apartment, my husband and I and our kids. But it was close to my parents, so I could lean on them for support. And I ended up being in about 6 months of very intensive psychiatric care and a lot of counseling and therapy by qualified people. And I did it singly, we did it couples, and did it as a family with my oldest daughter, who could understand a little bit of what was going on at least. At the end of 6 months, I was pronounced able to face life again. And so we ended up heading back to Thailand. And I was on antidepressants and remained on them. I've tried a couple of times in my life when I have felt like, hey, everything's great, I can do this. Tried with a doctor's help, weaning myself off of an antidepressant. And every time I do it, I end up cycling back into a depression. I've been through a fairly major depression one other time, and that was during my divorce from the husband who did continue to be angry and be verbally abusive. So, no longer married to him. Married to a wonderful man now, but even being married to a wonderful man and having a terrific family doesn't mean that I'm no longer subject to depression. What I've realized, what I've learned, is that the kind of depression that I have is, first of all, hereditary. My mother was depressed, which is something I found out well after I already had depression. My grandmother, so her mother, had been depressed and been treated for depression. I came to find out I had aunts treated for depression, and in the course of time, both of the daughters that I gave birth to have also had to go on antidepressants and be treated for depression. I have continued to have to battle with depression. The tools, though, that I have now, first of all, I know what it feels like to begin to cycle down into depression, and I can head it off at the pass. I usually have to try a different antidepressant about every 2 to 3 years because they simply lose their effectiveness with me. So I have to go to something else, wean off of one and on to another. But in spite of being on antidepressants, I will still, when there are situations that arise that cause intense stress, I will still begin to get the feelings, and there may be a little sadness at the beginning, but most of it, sometimes it also wells up in some anger, but a lot of it is just a feeling of hopelessness. Like I'm out of control, things around me are out of control, and there's nothing that I can do about it. I will start having very agitated sleep or waking up multiple times throughout the night. That's one of the first signs that I've got issues. The sleeplessness will make me drowsy, make me tired. I'll become physically and emotionally tired when I'm beginning to go into the grip of depression. My appetite changes. And sometimes it increases, sometimes it goes down. But appetite changes. Any any of those now, though, are a signal to me that I need to get back into the doctor, back into the psychiatrist, look again at my meds, and potentially get back into counseling. I'm a huge believer in the effectiveness of counseling. And I don't believe that if you have depression, you should not be treated with either drugs or counseling. I think both are necessary. But these days, at least, I am stable most of the time, and I'm still a happy, positive person. I still have never met a stranger, love people around me, love my family. Life is good. So life is good. I just happen to have this little condition known as depression, which is just an imbalance, a chemical imbalance in my brain that I need some extra help for once in a while. I was going over it. Here's just a few of the antidepressants. I've been on, there are varying kinds of antidepressants, right? Well, I've been on like tricyclic antidepressants. I've been on both Elavil and Tofranil. Neither of those did the trick for me, so I was not on either of them very long. Atypical antidepressants, you've got things like Wellbutrin, which I was on for a good little while, and Trazodone, which I've been on and off several times. And in fact, I'm on again now, and I'll tell you why in a minute with my other antidepressant. I've been on some SSRIs. Those are the selective serotonin reuptake inhibitors. I've been on Celexa. I was on Celexa for many years. Been on Lexapro. I've been on Paxil, which also helped with some anxiety. Recently, though, I've been mainly on SNRIs, which are selective norepinephrine reuptake inhibitors. And the last one was Effexor, and I am currently on Cymbalta. But right now, because again, added stress, this feeling of losing control, being hopeless and helpless because of stressors in my life, I am now on Cymbalta, and I started out on 20 milligrams, and they upped it to 40 milligrams. That was 20 twice a day. And just a couple of weeks ago, I had to have it up to 60. This happens to be a kind that I take once a day, so it is a slow release. But in addition to that, because I went into some real severe problems with my sleep, they've also, and anxiety, they've put me back on Trazodone at night too. Hopefully, in a relatively short period of time, I can be taken off the Trazodone and be just on the Cymbalta. But I'm not afraid of the medications because I know how much they help my life, nor am I afraid of psychiatrists or psychologists. And whenever I have the opportunity to speak to anyone about my depression, I do it openly, because to me, having depression should be no more embarrassing than being diabetic. It is a chemical imbalance in your body. You're not depressed because you're weak. You're not depressed because you're an inferior person. You're depressed because there's an imbalance of chemicals in your brain. Just like there could be a lack of something in your body that causes you to have a different disease. But fortunately, depression is one of those things you can live with, and you can live victoriously with it through the help of the antidepressants, the medication that they have there, and the psychiatrists, psychologists, counselors that are there. So I would urge anybody that even suspicions that they might have depression, be open and honest and upfront about it. Don't fear that you can't tell anyone about it. No one should think less of you. It is simply a condition that's treatable, and you can overcome in spite of it. Well, thanks for your time today.